You are listening to Seniors Junction podcast. We're preventing seniors isolation one conversation at a time. Your hosts today, Namrata Bagaria and myself, Paul Merkley, we're the co-founders of Seniors Junction, and our very special guest today, Professor Anna Garnett. She is a professor in the Arthur Labatt Family School of Nursing at the University of Western Ontario in London, Ontario. Welcome.
Thank you. Thank you.
So can you tell us a little bit about yourself and what you do?
Yeah, thank you. Thank you very much, Paul. Yes, as you mentioned, I'm an assistant professor in the Arthur Labatt Family School of Nursing at Western. I'm also a registered nurse, and I have a background in community nursing and palliative nursing prior to entering into academia. And right now, my research program is centered around supporting older adults who are managing chronic conditions and their care partners to help them maintain their health and their independence in community settings. So to date, my research has explored experiences of care partners of older adults stroke survivors and their experiences in attempting to access and use formal services once they're back in the community. I've also explored different approaches and tools that can be used to help older adults manage chronic diseases. So this would be things like self-management in the context of managing multiple chronic conditions, and some work around identifying the most appropriate tools to help older adults manage their health. So for example, a self-report tool for physical activity. Most recently, my research is seeking to understand how older adults and their care partners have been impacted by COVID, with particular focus on how they've managed physical separation, both in the context of long-term care and also in the community, where older adults have been sort of faced with these strict pandemic-related mandates on in-person gatherings. So one of the studies that I'm working on has really sought to understand the experiences and the support needs of family members and long-term care residents who are physically separated from their family members throughout COVID as we continue to deal with it. So with this study, we were wanting to understand and look at the impact and the experiences of social connectedness in the light of physical restrictions on family members and residents, but also understanding this from health provider perspectives as well, and how they were able to or not able to manage the situation of social connectivity in the face of physical restrictions, with the goal of developing guidelines to help support long-term care homes going forward and managing social connectivity, not just in the face of pandemics, but also sort of going forward, recognizing that there are different ways to support social connectivity. So this work is being done with a team of researchers from Western, mostly in nursing, but also including a professor from health and rehab sciences or rehabilitation sciences. So she's a trained occupational therapist, and my other co-investigators on the project are nursing professors from my School of Nursing. So that would be Dr. Lori Donnell, Dr. Cheryl Forchuk, Dr. Abe Utzhorn, and Dr. Babenko Mold. And one of the other studies that I'm working on is looking at those older adults who are in the community and the challenges that they've faced with social isolation, and trying to understand the concept of resilience and what it has meant to them in the face of COVID. So again, this was a little bit looking at the intended and unintended outcomes of the sort of government policies that restricted in-person engagement for these older adults, and also seeking to have them identify what they think has helped them be resilient in the context of social isolation in COVID. And again, this is conducted in partnership with the Canadian Centre for Aging and Activity at Western. And my co-investigators are a professor and director of the Canadian Centre for Aging and Activity, Dr. J.B. Orange, as well as my colleagues in nursing, so Dr. Richard Booth, Dr. Lori Donnell, and Dr. Fiona Webster. So that's
wonderful.
Are the participants in the first study that you described aging in place or living independently in a residence, or are they in long-term care and assisted living?
So in the first study, what we're looking at is actually the care partners. So these would be the family care partners, and they are living in the community, but they have family members who are residents in long-term care. So, but we were primarily interviewing the care partners.
Relatives of long-term care. And
Yeah.
then in the study you mentioned just at the end, these are people who are living in their own homes or aging in place in some way.
Yeah, aging
Thank
in
you very
place,
much.
definitely.
You need to clarify. Thank you.
Yeah, yeah. No, that's it.
I think Dr. JB Orange is very kind. He's forwarded the reach out I had to him to a lot of researchers in his circle. So we've recorded quite a few podcasts thanks to him. And so that's a shout out from my side to him. Thank you again, Dr. Orange.
Yes, he's very engaged in this sort of research.
I've never met him. I wish I one day get to meet him at least. But my question to you is, you've already mentioned a couple of pain points around social isolation in the older adults. Is there anything further you want to add to? What are the anything more about what perspectives you found in your research in isolation?
Sure. I'll probably talk a little bit about the family care partners and the situation of how they managed with another family member in long-term care first, because that was very, very powerful. And, I think of what, we immediately all thought about sort of the physical declines and either related to COVID or otherwise from care. But I think what's come out also very powerfully is the emotional health of both the family members and the residents in long-term care, and that their emotional health is really central to their health and well-being. And it wasn't just about physical health. If they had huge declines in emotional health, the residents declined, even though, they were sort of may have physically been fine. But also that the toll this took on family members, the constant stress that they incurred, other health declines as a result of what they were dealing with. I think there was the role for technology really came to the forefront and did amazing things for some family care partners and their residents. But it also highlighted lots of issues related to accessibility and access and even suitability, and in some cases even exacerbated more the disparities between people. So when we look at family care partners, those who are comfortable using technology, who had the means to access it, so they were financially well off enough to have access to good computer equipment or iPads. They lived in a place that had good broadband internet, something many of us take for granted. So there was that side of things. And also, were they comfortable using this technology? Was there somebody available to support them if they weren't? And that could have was really key in some cases for facilitating social connectivity. In the long-term care home side, there was the issue of staff workloads and, the access to equipment in the long-term care home. And then there would be, the time required for them to do this. And, as many of us know, staff was completely overwhelmed, meeting the basic sort of necessities for life for residents. So this was something that really was low down the list and was just another burden on them. So there was issues of burnout for staff, and it wasn't that they weren't maybe able or willing to help, they just didn't have the capacity. I think the other piece is that, we all think technology is the great way for the future, but, there were a lot of residents that couldn't benefit from it. And some of them, it may have actually resulted in more issues, for example, like responsive behaviors, because they were confused by it. As many residents in long-term care have dementia or some sort of age-related cognitive decline, this can make something like, a Zoom meeting that we take for granted actually could be difficult and even detrimental to their health. So I think these were other points that very much sort of emerged from the issue of tackling social isolation in the context of COVID, and particularly in long-term care. From a community perspective, I think many of the same issues emerged, although perhaps, less to the forefront. Again, I think there were the people that managed very well with social isolation and were, as we would describe, very resilient. They maybe lived in well-connected communities. They found other ways to remain connected. For example, some of our participants talked about doing drive-bys or, patio visits. Some even talked about maintaining their volunteering, but just doing it by Zoom. But then, at the other end of the spectrum, there were people that were hugely isolated. For example, some participants spoke about being excluded from other people's bubbles, that they tended to prioritize immediate family over friends, and some older adults didn't have a family network nearby. So they felt really, really excluded. Others may have been willing to use technology, but they didn't have the experience. Perhaps there was some fear, uncertainty, so they avoided it, and they never really got on board. And I think that's an area we need to explore further, about the uptake of technology. What was it? Is it they just couldn't get their head around it? They needed some support. They didn't want to admit they needed support. I think these are all factors that are ripe for exploring further. And others spoke to the fact they just felt it was a poor replacement, a FaceTime visit. It just couldn't take the place of a physical connection. And I think there was also, different types of social isolation that happened, I guess, were connections with community. One participant in one of our studies spoke about, going to the community pool was like a regular part of their life and their opportunity to engage with others. And because of the impact of COVID, the pool actually closed altogether, and then they said, well, I'm not comfortable, having to drive further to find a new place, to establish a whole new network. It was sort of beyond where she was at with her capabilities. So I think, many of these issues pertaining to social isolation have existed beforehand, but COVID really has exposed them, and drawn our awareness to them. And also, when I go back to thinking about the care partners in long-term care, like the need and the recognition that, we're not just dealing with an older adult or an older adult patient or client, but we're dealing with a whole family. And I think that's also come to the forefront in COVID and addressing social isolation, that you can't look at an individual in isolation. You need to look at their family. So including the family member as part of the care team, but also, looking beyond that and looking at what their community connections are. What are the social determinants of health that are impacting them? This sort of holistic approach, which was something that I had the opportunity to experience as a community nurse, because you went into people's homes, you really started to get a sense of what they were living with on the day-to-day, whereas, in an institutional setting or a hospital setting, it's to some extent an artificial environment compared with what people are dealing with in the community. But by the same token, when people are in long-term care, this is their home. And I think the recognition that with COVID, we separated them with concerns about physical safety and the emotional impacts were immense, continue to be immense, and we're not just immense for them, but also for their family members. And I think that's a fallout that we can learn a lot from, but I think the fallout will continue for a long time when COVID has passed.
Thank you. It's a wonderful answer. So you have addressed some of this in part. I wonder if you would want to say more about your vision, and I'm especially curious if you have identified or thought about the factors behind the resilience you refer to.
Yeah, no, that's a great question, and I do think that that's something that we as researchers need to explore further. And I think it's also where an organization like yours comes into play with the kind of the mobilization of the knowledge that we are gathering. So I think, sorry, just to reiterate, so you wanted to understand factors that are coming into play.
I was just wondering if you had considered that. And I don't want to restrict what you're saying about vision, but it just struck me, the resilience came up, and I thought, well, I wonder if you thought about what are the ingredients in resilience? How is it that some people are more resilient than others in situations? And as you correctly say, isolation was a problem before COVID, and if we ever get past COVID, isolation will continue to be a problem.
Yeah. No, and that's the point. And to be honest, as a researcher, that's something I fear, that, people say, oh, okay, COVID will be behind us, but I worry that essentially it's closing the door on all those issues again. So I think, things that have come to light are the incredible role that community engagement has to play in supporting older adults, and engaging them and recognizing that community and family are intertwined, but that so many people can fill the role of family community engagement. And it's so important to find different ways to connect with these older adults, I mean, in general, but also particularly with older adults. And I think it's about finding, different points of engagement. As our one study showed, it's some was, physical activity, volunteering, meeting on their patio. So I think there's a real factor is about meeting older adults where they're at, and recognizing that we can't put older adults in a box and say, you're all going to go to the Y and you're going to engage in this community activity together and you're all going to feel great. That's not going to work for everybody. And I think that's where there needs to be more effort to not using sort of a one size approach for all, and recognizing that, some people spoke about how, they actually liked engaging on Zoom in their home. They felt like they didn't have to go out. They didn't worry, say in the winter about falling. They could do their physical activity, via Zoom. So I think we need to have a better understanding about, different models that support different people, and recognizing older adults as individual and social engagement. Like I said, it's not all about getting together as a group somewhere. Social engagement could be, somebody dropping by, I think also bridging gaps between age groups. I know certain places, McMaster's, I know, has a project going to bridge gaps between university students and older adults. So these would be ways, that we could find ways to engage older adults in the community and sort of meet them where they're at, to try to figure out, like, what are their needs? Is it they're averse to using Zoom or FacePad, or is it they don't understand, or they just need somebody to spend some time and walk them through it? I think we definitely need to look at the factors related to the social determinants of health and getting people access, and not, we can't jump on the technology bandwagon and then realize that there's a huge segment of the population that are eclipsed from it, either, you know, because of their rural location, and as I mentioned earlier, the internet access, or the cost associated with it, or the cost, you know, monthly internet fees are expensive. And when you're on a fixed income, that's a lot of money to, you know, spend on that. You're going to have that and your phone line. So I think these sort of areas are places we need to look at. Another would be a change. I think it's a, you know, a systemic change. And I think that's come out loud and clear with long-term care, that family care partners have got to be an integral aspect in the care team for these residents. You know, and again, and I think it's finding ways to include them. You know, it's easy to think about the family care partners who wanted to be there physically, but I think, you know, there are a lot of people who have family members in long-term care, perhaps in another city, another province, you know, and it's finding ways to bridge those gaps as well. It's not just about physical access. So I think it's, you know, from my perspective, we need to, you know, have a lot more creativity about how we meet older adults' needs. I think we need to include them more in our discussions and our explorations and our research. And like I said, I think, you know, move away from a sort of one size fits all approach. And it doesn't mean one way is right or wrong, but just, I think, recognize that there are many, many different ways, and connection and engagement means different things to different people. And I think that's also important to understand when we're looking at our vision for solving this. I'm not sure if that answered your question in a bit of a roundabout way.
Thank you very much.
It resonates with what we, I think. So for me, this is a lot of validation. Everything that you, yeah. So that's we this year we did a summit, or we're doing a summit actually. We're recording this early on for people who are listening. We recorded this early on, so it's on September 17th, and the theme is personalizing social connectedness. So that's the theme. Like, yes, it's a group activity, but how do you personalize it? And me as a digital transformation researcher, this is the question that I'm actually looking at in application, maybe not the thesis so much. I mean, because you have to take parts of thesis, you know, is a very nuanced thing. You can't keep shifting it as you find answers. But I think going to what you said about vision, about meeting people where they're at, and other points which you mentioned. So what do you think are the barriers and opportunities? And you alluded to many of them, but if there's anything further, yeah.
Yeah, you know, I think some of the challenges even just relate to sort of attitudes and beliefs. You know, I think, you know, and I'm speaking sort of from I guess a Canadian perspective, but, you know, historically, we've always sort of prioritized, I think, physical health over emotional and mental health. And, you know, I mean, and it's, you can understand in a sense, but our healthcare has always tended to be oriented towards acute care, acute health needs, you know, and I think there needs to be some sort of reorienting. Increasingly, we've got an increasingly older adult population. They, for the majority, want to remain in their homes as long as they can. Our health system is no longer at the capacity that can support them in hospital settings. I mean, people are going home, you know, with higher acuity than they ever did in before, or they're, you know, discharged from hospital. You know, and so I think part of the challenge is that we've got to recognize family members are integral to the care team. And it's these family members that are supporting older adults in various capacities. And this can be, you know, spouses, partners, children, friends. You know, I use the term family care partner, but that can take many forms. So I think that's a challenge. I think that's, you know, a challenge on many levels. That's something that we need to work on addressing. I think from a long-term care perspective, they don't currently have the time, resources to really support new initiatives at the moment, like virtual engagement in the absence of in-person visits. And I think this is something that needs to be on the books going forward. You know, there needs to be funding allocation to growth, not just maintaining the status quo and waiting for the next, you know, outbreak, pandemic, crisis situation. We need to learn from it and really, but put some money where their mouth is and grow from it. So I think, you know, I think that will be a challenge, because it's, you know, once it's passed, it's easy to move on and not make change. You know, we saw that from SARS, for example. You know, there were many things written, you know, in a document afterwards exploring, you know, what went wrong, what could we have done better, and they weren't necessarily all implemented. So I think we need to be careful that we don't just sweep COVID under the rug and move on from it, but we really need to try and learn from the lessons. And I think that will be a challenge because it'll take time, resources, of different types of resources, money. I think another challenge, which I've alluded to a lot, is that technology is not going away, and it can be beneficial in many, many ways to older adults, but it doesn't work for everyone. And it's not there are many ways that we need to grow and better adapt. And I don't think it's ever going to take the place of, for example, in-person visits. So I think we need to be cautious, not treat it as the great panacea for social isolation in older adults. You know, so to think about that. Opportunities, if we were looking at opportunities that we have, I think, you know, things that we've learned, certainly out of my own research, I've seen older adults are resilient. They're incredibly resilient, and they're incredibly adaptable, and they have done things that, you know, I'm not sure, you know, some people would have believed were possible in the face of the adversity that COVID has brought. So I think the opportunities that we've got to be creative about how we support them, and that they're willing, able, capable to support them. We have to meet them where they're at. I mean, I've seen people in their, you know, 90s, you know, becoming comfortable FaceTiming, using their iPad, texting, emailing, you know, they are capable. So I think we have great opportunities to support them. We have to recognize that and see them as the capable individuals they are, and not succumb to ideas of ageism, which I think is hugely important. I think we ought to have great opportunities to bridge between, like I said, you know, younger generations and older adults. Younger generations have so much to offer, and older adults also have so much to offer. And I think we could work more to bridge those gaps and engage them so that they can support each other. I think, like I said, technology is important, but it's not an all or nothing. And as I think I mentioned, we've got to learn and grow from COVID, and we've got to continue addressing social isolation, and it's not going away. And as I mentioned, Paul reiterated, it was there before COVID, and it's still going to be there. And we have to really, it's an opportunity, and I think we have to really keep it on our radar. And, you know, social isolation, you know, can greatly impact emotional well-being, and emotional well-being is crucial for well-being, not just physical well-being. And so we always have to keep that at the forefront.
Thank you for those remarks. So you know that we're a company that seeks to provide serious leisure and purpose and personalized leisure. What advice would you have for us?
You know, I think what you guys are doing is amazing. And I think you're in a really great position because you are, to some extent, a bridge between, you know, people like myself who's working in academia, and, you know, you're a bridge between people like myself and older adults, but I think you're also a bridge with the community on many different levels. You know, when we look at education, when we look at politicians, lobbyists, you know, I think your organization can bridge those gaps, participate in those conversations, and be a voice, both for people in academia in terms of a knowledge mobilization perspective, but also for older adults, and get those conversations going. And I think what we're doing here today is just so important, because outreach advocacy is key, you know, and we need voices at many different levels. I think for an organization like yours, I think, you know, tackling the notion of ageism is huge. It's important. I mean, obviously it's something you guys believe strongly in, but I think you have a strong role to play with that. And I think, you know, the conversations that have come to the forefront with COVID, social isolation, I think you can keep them alive, and keep, you know, people like myself working on it, recognizing, drawing it to the forefront, so that funders, systems, health systems, you know, that they're aware of these things, and we keep those conversations going, so that we really try to bring about change sort of at a health system level too, not just, you know, in small enclaves or, you know, bits and pieces scattered around. It's got to be sort of from a grassroots up type change, and I think you guys are in a great position to help support that. So
Thank you.
thank you.
And this was just a wonderful podcast. And before we sign off, if people want to find more about you, where can they find you?
Yes, they can reach me at my Western email address. It's agarnet6@uwo.ca. So that's AGARNET6@uwo.ca.
Thank you.
Thank you very much. You've been a
Such a
wonderful
lovely
guest.
podcast. Yes, thank you. Thank you so much.
Oh, thank you so much for having me.
Our pleasure.